From brain drain to medical tourism to frequent industrial actions by health workers to insufficient healthcare facilities, poor infrastructure to mention a few. These are some of the challenges confronting Nigeria's health sector. With healthcare being one of the most important aspects of human life, it is no wonder why Nigerians lament on the state of healthcare delivery in the country. The new minister has so much on his plate, especially as providing quality healthcare is one of the major thrusts of President Bola Ahmed Tinubu's administration. But to talk on this, joining us in the studio is Chief Medical Director, Heritage Men's Clinic, Dr. Rasheed Abbasi. Good morning.
Good morning.
Thank you for joining us.
My pleasure.
Good morning to you.
Good morning.
Let's get from your perspective, because you're a player in this sector, how we have fared, how well or otherwise we have fared in the aspect of healthcare delivery as a country.
Unfortunately, healthcare delivery in Nigeria is failed because it was just poorly foundationed. So when you talk about healthcare delivery, Nigeria has a three-legged stool. We have the primary healthcare, the secondary, and the tertiary.
Right.
Unfortunately, the federal government only gets played in the teaching facilities, and the rest is left to the state and the local government. For example, we have about 30,000 primary healthcare centers all over the nation. Only about 20% are functional. When you talk about medical tourism, no Nigerian goes abroad for primary healthcare. They go for specialized care. And yet, Nigerian system does not have any adequate provision for specialists. So it's a big problem. And then when you go down the drain, you're talking about problem with the professionals, talking about brain drain, because people are looking for greener pastures elsewhere. So why can't we make the grass a little greener on this side? The good news is, because it's really failed, we have another opportunity to actually start afresh.
But before it got to this point, there was a time where we saw persons from other countries coming to Nigeria to,
From Saudi Arabia.
yes, saying they want to use our healthcare facilities and all of it. Where did we get it wrong along the line?
No, that's an excellent point. So if you look at the genesis of Saudi Arabia healthcare, this was all the brain of Nigerian experts. So what happened when Nigerian experts started going abroad and not coming home? That was our first pitfall. Because the moment they left, they created a vacuum. That vacuum was actually instrumental in our medical education system. The medical education system fell apart, and we started let's take, for example, the United States. We have 125 medical schools. We produce 17,000 doctors a year. And our system tells us that we're not producing enough. Nigeria, there is no way for us to measure how many graduates we have. We don't have any medical intelligence, which should be driven by data. Wow. Because once we have the data, then we know where we're lacking, we know where we're doing good, but we don't have that.
So let's talk about funding, because countries like Rwanda and South Africa, they have fulfilled their own commitments to the Abuja Declaration made by the African Union, urging countries to at least 15% of their budgets be allocated for the healthcare. 22 years after, Nigeria has not, fulfilled this. It's not even anywhere near the 15%. So, what do you think Mr. Pate can do to get governmental, departments, governmental officials, lawmakers, and pertinent ministries to see the need to invest in healthcare sector?
Mr. Pate can do as much as President Tinubu allows him to. If President Tinubu makes healthcare a priority, 15% is not going to be a big deal for Nigerian government to do. So Mr. Pate dances at the tune of the president. So
regardless of the National Assembly, trying to prune the amount of money allocated to different sectors?
Because the president will come with his priorities in terms of his budget. If he says, look, I want healthcare as my priority, then we'll see the sign in his budget. And that's when Mr. Pate will be able to go down to play. He's a good administrator. As I've alluded to on previous show, that we need a good administrator, not really a medical doctor to man the ministry. He's an administrator. He was at the World Bank for about 8 years. So he has what it takes. But he needs the president backing. And that will only be evident in terms of the budget. If the president comes out and says, look, healthcare is my priority, then that's it. Let's go for that.
Now, when we're even talking about effective and quality healthcare, give us a sense of what it is exactly.
Good. So, I have about 25 years experience practicing in the US, and their system is based on three-legged stool, but different from Nigerian three-legged stool. We have the primary health care, we have the urgent care, and we have emergency care. The goal of any practitioner is to reduce the number of people that end up in your emergency room.
Absolutely.
Because by numbers, when you are in an emergency situation, you are likely to die.
Yes.
So the goal is let's develop more on primary and urgent care. Nigeria doesn't have any player in the urgent care system. That's number one. We don't. Because all we have is primary health care. We have 30,000 of those PHCs. Only 20% are functional. So a lot of people do not get care in the primary sector, and then, boom, they end up in emergency. So there is no transition.
Right.
That big space is a big void. Talking about funding, when you want to get into that place, I have a small clinic. I have only about 15 employees. In terms of ready to expand, banks are offering me money, but at 27% interest. It's not sustainable.
Yeah.
So if the government comes out and says, look, healthcare is a priority, just like they do to religious organizations and give them tax exempt, you can cap the interest rate for healthcare providers. So private sector can come in and play because government alone cannot do this.
So is it only the private sector that can handle the urgent care?
Absolutely. And you know why? When the private sector comes in, it's a free market system. They know there is money at stake. And then they can now compete. When they compete, when you bring in specialists, most specialists that I know of in medical practice were once internists, were once primary healthcare providers. So they will be able to handle your PHC, and then they will be able to handle your urgent care situation. And as a result, there will be less and less fewer people ending up in emergencies.
Interesting. Let's try to explore the PHC, the primary healthcare system in Nigeria. I remember sometime 2-3 months ago, I was talking to one of my cabinet makers. He said he was down with maybe malaria or anything. I asked him to go to the primary health care that he would get subsidized care from there. So he went there. He said he was treated. They gave him different drugs, and then it's aggravated what happened to him. And until he went to a private hospital that he didn't want to go in the first place, so he had to spend even more as against what he spends in the primary health care system. So this speaks to the unskilled workers that we have, caregiver that we have in primary healthcare system. Talk to us about necessary reforms and initiatives needed to overcome these obstacles in the primary healthcare service.
Absolutely. If I have the magic wand, one of the things I will advocate for would be the medical intelligence. We need to actually know what's going on. How many doctors are we providing? How many of our products are going into primary healthcare? How many are going abroad? How many are going into specialization? And then when you talk about the funding, remember years ago when Nigerian doctors were going to Saudi Arabia to develop Saudi Arabia, they never came back. What happened to that vacuum? Our healthcare institutions, University of Ibadan used to be the Apple. Yeah. Nobody goes there anymore. Complicated with people leaving for greener pastures, lack of funding, and that's what led to the inadequate preparation of our primary healthcare providers.
No, when you said that they went to Saudi Arabia and they never came back, is that lack of patriotism on their own side? And because if we had them on ground, maybe they would have spoken better, better to the government in order to, invest in this particular sector.
I think you can make that argument that we don't have enough patriotic bonds, so some of these people go abroad and then they never came back. But then there is a big issue with the government not even knowing how many of your doctors have left. Because if we have the medical intelligence or we have the data collection, then they know. It's just because you can imagine, let's assume they retired and they never left. They retired. We need to be able to fill that vacuum. The moment we fail to fill that vacuum, there is no more, succession. We don't have that. And that's what led to poor education system. Once our education system has failed, we don't have any plan for future ones. And so your primary healthcare situation, when you get there, the doctors are complaining that they're poorly paid, that they don't have enough equipment. So when you and I show up there, they're going to refer us to their own primary places, to their own clinics where they think they can make more money. And we've not even talked about the issue of pharmaceuticals.
Right, interesting. Talk to us.
Some of these PHCs, they are inundated with just poor medications. NAFDAC is not big enough to handle them when they bring in fake medications. And these are things where medical intelligence will be able to let us know. How many of our people are given wrong medications for malaria when they shouldn't be? How many of our pregnant women are not being timely attended to? Medical intelligence is what we see in the US, what we see in Canada, what we see in UK. So that's why they can tell you and I that, look, if we're suffering from stroke, you should be seen within certain minutes, because they get that from their data. If we don't have that, we're just going to be rewinding.
What would it take for us to have that medical intelligence? And perhaps you need to expatiate on what this medical intelligence is all about.
So during the COVID, one of the things that helped us, or perhaps Ebola, let's take a step back.
Yeah.
Because we had a couple of Ebola cases in Nigeria, and we thought we dodged the bullet. We did not really. We were able to escape it because we had a little bit of data collection. During the Gates, the Bill Gates and Melinda, when they came to the north during the Pfizer episode, we had a lot of epidemiologists. They had contact tracers.
Yeah.
Those were the people that they were able to recruit. So when you're talking about medical intelligence, you're going to have a lot of disease epidemiologists. You're going to have statisticians. These are people that you can call upon when emergencies happen. But it needs to be government funded, and then private people can come and play. Because when the government provides that, then the government will have a little bit of leverage.
Funding again coming to the fore.
And so, so still talking about these, pharmaceutical drugs and all of that. If I'm not sure who is fighting against this drug abuse, we know NDLEA is doing its own, playing its own role.
Yes.
NAFDAC is also doing it, playing its own role. But we still find some, hawkers who hawk drugs, they hawk medications and all of that.
Yes.
And they will administer to you like, go and ask nurse. They call them nurse, they call them this, and all of the names that you shouldn't call them, to call professionals instead. So what do we do about them?
So we cannot put all the blame just on the government, because we also have to be educated consumers. A lot of our people just do not have an idea. I have a little bit of headache, they're going to the nearest chemist. The chemist is not licensed, not a licensed pharmacist, not a licensed MD, and they're willing to take it. Just like you have different people selling local herbs. Nothing against herbs, but we need to have educated consumers, because educated consumers will drive it. Just like we want a good leadership, we have to vote for the type of leaders we want. So educated consumers will advocate that, look, you don't go to just any pharmacy, you need to go to a doctor, and the chemist or the pharmacist should not be selling prescribed medications without prescription. That's all you see around. So when we have medical intelligence, we'll be able to track how many of these illegal places are killing innocent Nigerians. And then enforcement can come in. We don't need funding for that. We need enforcement, because we have the appropriate agencies already, but none of these things is being enforced.
Amazing.
Health insurance is another big issue in this country, because out-of-pocket treatment is a lot. And a lot of persons have lost their life as a result of not being able to take care of some of these bills. How do we deal with, educating people on the importance of getting healthcare insurance, and how do we even spread the net? Because there's been matters of corruption. It has been, met with a myriad of issues, right?
So when you're talking about coverage, health insurance, there are only two major players. It's either private employee or government insurance. And so in the likes of US and Canada, we have Medicaid. Medicaid means the government provides for people who are disabled or who are underaged. Medicare, for those who have worked and actually supported the system. Now they're elderly, 65 and above, the government steps in. With the exception in the US, where anybody, regardless of your socio-economic status, if you're on dialysis, the US government pays for that. That is, we're talking responsible governance. But in the case of private sector, we have to create jobs. So I live in the state of Maryland. The second largest employer in Maryland is healthcare system, not the government.
Right.
So if we have good healthcare facilities, they will definitely employ. They can even start employing and start training, so it will go against brain drain. Because we can train our own technicians, X-ray technicians, ultrasound. We can train them locally. So yes, you cannot stop every Nigerian from traveling abroad, because they're looking for greener pastures. But if you make the grass a little greener here, so in order to satisfy coverage, you need private and government. The government cannot do it alone.
How do we even make the grass greener? Because it's an interesting one. We keep hearing people, in fact, this month that we just got in now, we hear another batch of persons leaving the country. How can the government make the grass greener? Because it's a huge challenge as it is. 200 million Nigerians not having enough hands to handle their medical issues is a disaster, so to speak.
It sounds like a repeated one, but we need data, right? Lagos, conservatively, is about 20 million people. Washington, D.C. is about 1 million. We have 7 big hospitals for 730,000 people. It's the data that drives your development. So if the government has a way to collect all that, they can at least start with medical education subsidies. Medical education subsidies allows you to know that you are training your best, and now you can now make them sign contracts. 3-5 years of you being sponsored by Lagos State or federal government, you cannot travel abroad. That gives you a pathway.
Do you remember what transpired some months ago about this person should not be allowed to leave the country at the National Assembly and how that caused some ripples? That's what you're saying.
No. But see, I went to medical school in the U.S. My parents could not afford it. The U.S. government gave me a loan for 30 years. It's a contractual agreement. So it was difficult for me to even say, after 2 years, I'm packing my bags. And besides the fact that I knew that, oh, these people bailed me out when I needed it the most, ethically for me, I won't do that. If Nigerian government steps in for their prospective medical students, and they can give them military loans. These are people that are going to the military and practice.
So are you excited about the student loan?
Yes. That was one of the highlights for me, that yes, this is actually a start. It may not be the best, but hey, somebody laid the foundation. That tells me someone has brain cells and they're thinking in the right direction.
I'm not thinking Nigerians are actually ready for that, because they felt that it's one of the ways to tie them down from leaving the country. Just like you said, you owe the country, duty to also give back based on what they've given you, to fund their education and all of that. So if Nigeria is proposing this, and then Nigerians themselves are saying that, no, this is a trap, we don't like it, take it back. So are we ready for development? Are we ready to address this challenge?
So, it's impossible to satisfy everybody. The NYSC still exists. Nigerians are volunteering to go for it because they think they might need a future political post. So that's the same way. You're not going to force everybody, but make it available. When it's there as an option, then it will be difficult for people to blame you that you didn't do jack. You offer it. Prior to this administration, nobody talked to us about student loan. And we have a lot of people that were smart enough, but they couldn't afford it. And that led to other social issues. So yes, let's give them credit where it's due. At least they proposed it. Then it's left to us or the people who are in the situation to either take that chance or not.
The matter of student loan came up years ago, I think in the 70s, but it failed because some persons did not pay back the fund. But let's look at the matter of infrastructure. It's another challenge because if you go to some of these teaching hospitals, you wonder, really, what's going on? If you go to some other hospitals across the country, you just wonder the state that they are in, how patients have to even buy certain things, whether it's for delivery or for critical care. It's just really not, it's a sad situation, so to speak, as it is. How do we address that? And how can the minister begin to look at low-hanging fruits that he can deal with as quickly as possible?
I think in a nutshell, the case of our infrastructure is deplorable. Let's call it what it is. It's just deplorable. If you ever take a walk, last you come, any of these big institutions, you just be like, it's not even adequate for animals, not to talk of Nigerians. In my personal view, I think the government needs to take a step back. We need more enforcement and need private players to come in.
Enforcement, how do you mean?
Yes. So all these, you go to a teaching hospital, they have government bureaucracy in terms of providing certain equipment. And that's where bribery, that's where corruption is endemic. When private sector comes in, government needs to enforce it. Because you can do a PPP with all these teaching hospitals, and the government has the enforcement tool. So you provide them some carrots, you provide them some cake, and that's what you do. Right now, everything is at the behest of the government, and it got stuck in bureaucracy. Some of these providers are complaining they're not well paid. So when you ask them to upgrade, they rather pocket the money. They divide it. It's a very deep system, and corruption is very difficult to get rid of. So we need the government to take a step back. The government can use their enforcement tool while you encourage private investment. Go into PPP. That allows you, and then there will be benchmarks. Because if whoever you sign PPP with, if they're not delivering in Lagos, you're not going to renew them in Abuja. You're not going to renew them in Lagos or elsewhere.
What is the implication of privatizing the health sector? Because I see the NMA, the Johesu, with any slightest provocation, they threaten strike, that they want to go on strike. And they've striked for close to 180 days, alone in this, recently. So would there be any sustainable resolution to addressing these industrial actions for them to speak towards, let's privatize the health sector? Why are they really not talking in that regard? Is it that it's a threat to their own jobs?
I think so. I think it's multifaceted, and that's why I still advocate that we need a good administrator like Dr. Pate. He needs to come in now with the backing of the president and say, look, let me bring every stakeholder to the table and let's discuss this. Because I think privatization is the right way to go. Government alone cannot handle it because healthcare is a business and it has an ethical, moral angle to it. So we cannot just leave everybody, because if I have a disabled child, there is no way I'll be able to provide all the healthcare needed. The government needs to step in. So there will be some niche for the government, whether for our elderly or for the underserved disabled. But then when privatization comes in, you are allowing free market to do it. And with Dr. Partey and the government's backing, the president's backing, he's a good administrator. At least that's what the CV says. And if you look at his track record, yeah, he can bring these people to table. That's what we need.
Right. Now, he has said that he was going to address the matter of medical tourism to end to it, and I'm wondering, how is he going to do that? And I don't know if you see that happening anytime soon.
Not anytime soon, trust me. Nigeria exports about $2 to $2.5 billion in medical tourism. Like I said earlier, none of these Nigerians who are going abroad go for primary health care. So another way to reverse that trend is let's make it okay for specialists back here. An example is the interest rate. Banks are ready to loan you money because apparently they have some issue about financing hospitals or financing schools, because if you bail out not paying the loan, they think it's not ethical for them to close it down. But then the government can step in and say, look, instead of 27% interest rate, let's cap it at this. Whatever rate the government allows it to be capped, now the government has leverage over that facility and say you have to be able to see certain number of Nigerians who are in need of this. In order to achieve Dr. Partey's goal of reversing healthcare tourism, is extremely difficult. We need to have the instrument on the ground.
The National Bureau of Statistics is actually doing a great job. You spoke to the issue of not having sufficient data because we rely on foreign agencies to provide this data for us. Is there a way we can have our own homegrown data so that we'll know this really represents us? Because whenever the NBS releases data, people would always dispute it. So what is the way to go? What policy formulation should come on board for us to know that, okay, when we have this certain figure, then we'll be able to sort this, tackle this problem headlong?
Good. So the example I'll give you is Atlanta, CDC in Atlanta. Their data comes from their medical schools. All the medical institutions have an access to give it to them. So if I see how many number of people with cardiovascular issues, high blood pressure, diabetes, stroke, I report directly, CDC filters it. We need to have something like that here because we don't have any coordination. Even though we have quote-unquote Nigerian CDC, there are no academic affiliations. And that's where your research and development needs to be focused because it's the academic institutions that will actually become your laboratory to produce what you need. And they will tell you where the data lies. So that way, maybe we're investing wrongly in some infection area. Not that infection is not dangerous, but hey, we're losing a lot of Nigerians to cardiovascular issues, high blood pressure, diabetes, stroke, heart attack.
Kidney disease.
Kidney disease. And we can prevent this because we consume a lot of salt.
Salt again, right. Now, let's quickly touch on this matter of homegrown solutions. Recall that during the COVID era, some persons will tell you, boil this, do this, do this, put it together, and boom, it works. Because the story then was that a lot of persons will be falling on the streets because of COVID-19. But Africans, Nigerians were able to, solve this problem. And we also know that in the rural areas, we see people troop to these traditional homes for healthcare and all of that, traditional birth attendants attending to some of these people because still out-of-pocket treatment. And these are the people they trust at the end of the day to deal with their issues. How do you see the minister perhaps looking at how to manage this sector to also help grow some homegrown solutions that people trust and believe and has worked to an extent?
Absolutely, and that's why, as a good administrator, he will look at all the stakeholders. So we're talking about the traditional medicine, the natural herbalists. He needs to bring them to the table because they're going to augment our pharmaceuticals. Some of these medications actually work. What the advocacy against them is all about is about dosage. And about who to use it and the, contraindication. So somebody like the health minister will be able to bring them to the board and see how we can refine them. Talking about how to regulate them, our curriculum needs to change. Medical school education in Nigeria has not changed in a decade. And look at our competitors or look at what we want to be like, the US government, the Canadian. They are reviving. So they are adding new topics to the medical education. So something like natural medicine, herbalist medicine, traditional can be included, and that can be, championed by the federal government.
Let us explore these, the disconnect between the school and then what obtains on the field. As an AA, I happen to always go down with malaria almost every month. I take the drug, you give you the drug, you take it, and then you feel that even another month you're having a problem. Forestry Research Institute of Nigeria, there is, I won't go so deep, right? But then there is this something I get from there. And when I take it, like three years, I feel like I'm inoculated from malaria, like I'm vaccinated until afterwards. So exactly where is the disconnect between the town and the gown?
Absolutely, I think it's about data. When we are able to collect the data, then we know where to actually invest. Because that's another avenue. We look at Nigeria. There are 3 countries that contribute to the most sickle cell. Nigeria, Democratic Republic of Congo, and India. These 2 other countries are investing. They're trying to slow down that number because you can address your issues when you actually know what you're facing. Nigeria is not doing that. And, you know, the medical association wants to think that they're more superior than this. It shouldn't be like that. We're talking about equal contribution. And who can do that is the federal government. A good administrator will bring everybody to table and see what they can do because everybody has a say.
Right, and that's a fine place to leave the conversation this morning, bringing everyone to the table to addressing our challenges in the healthcare system. Thank you so much, Chief Medical Director, Heritage Men's Clinic, Dr. Rasheed Abbasi, for your time on the program.
Always my pleasure. Thank you.
Thank you. Right.